All right, so please open your poll app, whichever app you're using, whatever you're using for poll questions, because we'll have some poll questions and we'll have current events and we'll have some discussion about the vitamin topic this week. On Wednesday are your sales pitches. To be honest, I don't know how we're going to do it yet. I figure I'll just go down my list, but if you want to talk to me, if anybody wants to do it and get it over with, that's fine. Please don't feel pressured because I've never done it in this situation before. So I anticipate a lot of confusion. So, and then next week we'll start water and electrolytes. Any questions before I get started? Okay, let's see what wonders the cyberspace has today for our presentation, my presentation. Let's see. Okay, you ready to answer poll questions? Oh, see, 5, 4, 3, 2, 1. Scurvy results from a long-term vitamin C deficiency. True or false? Five, 4, 3, 2, 1. All right, this one's true. And this was in the video. I think I gave you all a heads up in the video that there were some graphic pictures and a vitamin C deficiency because vitamin C is involved in collagen synthesis. And in absence of vitamin C over time, what happens is that tissues that have collagen in them start to break down, and your gums have collagen. And so over time, what happens is that that tissue breaks down and you develop a condition called scurvy. Beta carotenemia occurs when you have a vitamin A toxicity. True or false? Five, 4, 3, 2, 1. Let's talk. So vitamin A toxicity only occurs with the animal form of vitamin A. There are two forms of vitamin A. There's an animal form and a vegetable form. The animal form comes from animal sources. Liver is a source of vitamin, the animal form of vitamin A. Polar bear liver, I think I said in one of the videos, is toxic. But beta carotene is the vegetable form of vitamin A. And you can't overdose. You cannot develop toxicity symptoms from eating too much vitamin A from vegetable sources. What happens is you turn orange. Your palms of your hand turn orange, the bottoms of your feet turn orange, your skin turns orange because beta carotene, which is the chemical name for the vegetable form of vitamin A, builds up in your blood. Beta carotene, EMIA, means in the blood. It's not toxic. And that's something when you do your diet projects, if you wind up having 500 times or, you know, the recommendation for vitamin A, but it's coming from vegetable sources, don't worry about it. Don't say, I need to cut back on my red peppers, I need to cut back on my carrots, because you don't. It's non-toxic. Fat-soluble vitamins are incorporated into the chylomicron and absorbed into the lymphatic system during something. During digestion and absorption, or not during anything. Fat-soluble vitamins are incorporated into the into the lymphatic system. Is that what you see? I don't see that on my slide. True or false? Does anybody need any help understanding that disjointed statement there? Fat-soluble vitamins are incorporated into the chylomicron and absorbed into the lymphatic system. That's how the body metabolizes them. Is this true or false? Five, 4, 3, 2, 1. Let's see where my mouse went. Okay. And so this is true. Fat-soluble vitamins are absorbed into the lymphatic system like other fat, right? Especially these that have a lot of carbons in them because they are hydrophobic. In the videos, I compared water-soluble and fat-soluble vitamins. Fat-soluble vitamins are hydrophobic. They tend to be stored in the fatty tissue, and the way the body uses them in order to get them from the food you eat is that they are incorporated into the chylomicron and then transported along with fat. Unstable molecules are formed from sunlight, smoking, and pollution and are referred to as oxidative stress. The unstable molecules formed from sunlight, smoking, and pollution are referred to as oxidative stress. True or false? Five, 4, 3, 2, 1. Right. So we have antioxidants, we have free radicals. Let me just see what my next slide is. Oh, okay, I don't have that. And we have oxidative stress, and it's about balance. It's the free radicals that are formed from sunlight, pollution, smoking. And what happens is these free radicals can lead to, I have this written up here twice, can lead to oxidative stress when there is an imbalance between free radicals and antioxidants. And I'm going to try to do a demonstration. I'm not sure how. I'm going to need your cooperation when we're done with this to help you understand the difference between free radicals and antioxidants and oxidative stress. Professor Simons is not allowed to prescribe a pharmacologic dose of vitamins or minerals. True or false? I can't see my name up there. I can't tell you, I can't prescribe pharmacological doses of vitamins or minerals. True or false? Five, four, three, two, one. This is true. So I was talking about pharmacologic and physiologic doses, okay, of nutrients and of supplements. A physiologic dose refers to the amount that your body can physiologically handle. A pharmacologic dose is when you take large amounts of that nutrient, usually in supplement form. So what I have here, and I was talking about antioxidants because people, oh, you need to take beta carotene, it's an antioxidant. True, it is an antioxidant, but you should get it through food. Vitamin C, it's an antioxidant, it'll prevent colds, it'll do all these magical things. You should take supplements of it as soon as you start to sneeze. No, you shouldn't. First of all, when you take a supplement, that's all you're getting. If you take a vitamin C pill, all you're getting is ascorbic acid. When you eat an orange, you're getting potassium, you're getting calories, you're getting fluids, you're getting bioflavonoids, the plant chemicals found in oranges, for example. You're getting all these other things that help increase the bioavailability of vitamin C. Whereas when you take a supplement, that's all you're getting is that nutrient. And when I was talking about what I'm allowed to do, what does pharmacological mean? Whoops. What does pharmacologic mean to you when you see that word? What does anybody see in that word?
I think of pharmacy and like prescriptions, so like over-the-counter supplements or medicine.
Right. Pharmacological, pharmacy, pharmaceutical. When you consume something that's 10 times the recommendation, you're not taking a physiological dose of it, you're taking a pharmacologic dose of it. Your body doesn't metabolize it or see it as a food, it sees it as a drug, and it processes it differently. Now, one of the things that this is important to is when we talk about the toxicity of vitamins and minerals. So the water-soluble vitamins, well, actually, that's one of the questions in the discussion, but whatever. Water-soluble vitamins, because they are water-soluble, we tend to excrete what the body doesn't use. So there's less of a risk of toxicity. But fat-soluble vitamins, particularly the animal form of vitamin A, can be toxic when consumed in large amounts. And so and large amounts are pharmacologic doses. Now, if you have a deficiency, then you might need a pharmacologic dose. Somebody who's has iron deficiency anemia, they may need a pharmacologic dose. I can't prescribe that. I, as a registered dietitian, do not have prescription writing capabilities or privileges, nor should I. So registered dietitians cannot prescribe pharmacologic doses. That's a misunderstanding. We can make recommendations, although a good dietitian would say, if you have a deficiency, you need to talk to your doctor about it, and then if there's something I can do, but they should not be prescribing supplements without medical consults. Any questions about physiological versus pharmacologic dose? Okay. Let's see, what do I have next? Before we do current events, I'm going to stop this here. I want to, I don't know how to do this because if we were in the classroom, I would do a demonstration, and now we're online and I'm still going to do a demonstration, but I'm not sure how to do it. I need 3 volunteers. Let me tell you what we're going to do. Okay, I have Jackie. Who else wants to volunteer? I need you to be able to see everybody on the screen. That's the only thing. Okay, Alejandra, and one more person. Okay, Kyle, unfortunately, you're the one in my upper left-hand corner, so I'm calling on you. Okay, so here's what's going to happen. You're standing now next to me in the front of the room. I'm going to do a demonstration for you on how antioxidants and free radicals work. All right. So first of all, I need to tell you that free radicals, the body needs free radicals. They are part of our immune response, but it's about balance. As always, it's about maintaining homeostasis. And when we have an excess of free radicals in our body, whether it's from sunlight or pollution or smoking, not as a normal byproduct of our immune system, then we can develop what's called oxidative stress. And the hypothesis is that oxidative stress may lead to chronic illnesses. So that's where antioxidants come in. What antioxidants are supposed to do is help reduce oxidative stress. How do they do that? Let's talk. So the thing about free radicals is that they are unstable molecules. Molecules or elements are stable when they have 2 electrons in their outermost orbital. Bear with me. Go back into the gray matter. You learned about this once. Just trust me. They become unstable when they lose one of those electrons. So my 3 volunteers, I want you to raise your hands. Okay, I see 1, 2. Alejandra, were you one of my volunteers? Okay, 2 hands up. Imagine you can see everybody with their hands up. I don't know how you do that, so just imagine you will. So right now I have 3 stable molecules with 2 electrons in their outermost orbitals, and they're stable, okay? So what's going to happen now is that there's going to be a free radical being introduced to the system, and what the free radical is going to do is cause instability, because that's what free radicals do. And what they do is they tend to grab one of the electrons in the outermost orbital of other molecules. So Jackie, a free radical is now grabbing one of your electrons. So one of your hands goes down. Now act unstable, which of course, there you go. Oh, you guys are wild business students. I taught at Emerson one semester. They were much better at instability than you, but I understand. All right, so now you're unstable. So what an unstable molecule wants to do is become stable. So it's going to go around grabbing other electrons in order to become stable. So what you're going to do is grab, on my screen, Alejandra's closest to you. You're going to reach up and grab one of Alejandra's electrons. Okay, Alejandra, one of your arms is going to go down. Now your hands are going to go up. And now, Alejandra, you're unstable. Act unstable. Yes, so wild. Now she wants to become stable. So what she's going to do is grab one of Kyle's electrons. Grab one of Kyle. That's right. Okay, now Kyle is unstable. Okay, oh, look at that. Now I'm an antioxidant. What antioxidants are able to do is donate one of their electrons, but maintain stability. So Kyle, I'm next to you on my screen. Take one of my electrons. Okay, now you're stable. And believe it or not, I'm still stable, but what's happening is my shirt is going from black and white to all red. I have gone from one form of a stable molecule to another form of a stable molecule. Okay, let's give our colleagues a hand for being stable and unstable. So what's happening is that an antioxidant is donating one of its electrons to halt this oxidation reaction. And what it does is it goes from being one form of a stable molecule to another form. So for example, vitamin C is an antioxidant nutrient. One form of it is ascorbic acid. When it acts as an antioxidant, it then forms something called cocktail chatter, dehydroascorbic acid. It is still stable, but it has one less electron in its outermost orbital. And that's how antioxidants, or one way in which antioxidants work. They are able to donate one of their electrons and still stay stable, thus trying to halt this reaction that's creating instability, thus supposedly, at least in a petri dish, reducing risk of chronic illnesses that may be associated with oxidative stress. Thank you, guinea pigs, for being the first time I've ever done this online. Questions about antioxidant? Thank you. Okay, questions about that demonstration and what antioxidants and oxidants and free radicals?
So the antioxidants donate electrons to stabilize what kind of molecules? The free radicals?
Free radicals.
Okay, great.
I just watched something on PBS about Woodstock last night. I'm all into free radicals right now. Other questions? Okay, so let's have current events. We have a couple of current events. I have a list. Katie, Julia, Allie, Kevin, Megna, and HV. So who wants to go first? Okay, HV, go ahead. I can't hear
Hi,
you.
can you guys hear me?
Oh, there you are. I gotcha.
Can you guys hear me? Okay. Right. So I wanted to actually discuss an article related to scurvy because that's what we studied in class today as well. And scurvy, as we studied, is basically due to a disease that's caused due to lack in vitamin C. And vitamin C that we get mainly comes through our green vegetables as it contains the ascorbic acid. And this actually, I found this article really interesting because this used to be a disease very common earlier on in our lives when it used to be common within sailors because they used to be offshore for long periods of time. And obviously, the vegetables are perishable and you can't consume them after long periods of time. So, due to lack of ascorbic acids, they used to, feel symptoms in their gums and weaknesses in their tissues. So, that was a disease that was majorly problematic at those point of times, especially for the sailors. But what I read recently is that in Canada, I mean, this article was in February 2020, but it said that in Canada there have been an increasing number of scurvy cases, and it should not be forgotten about just because it was a disease for those who stayed offshore. I mean, it's important to get your dose of vitamin C, as scurvy is something that has been ignored over the years, and it's something that we need to look into a little more seriously, says some researchers from Canada. And Professor, one thing I didn't understand in the article, which I wanted to actually talk to you about, was that it said among those with scurvy, some were related to alcohol use disorder. So I don't know how that relates to scurvy.
Okay, so I'm not sure either. I know that alcoholics tend to suffer from a thiamine deficiency or vitamin B1 because thiamine is involved in the metabolism of alcohol. I'm hypothesizing that people who are drinking a lot of alcohol aren't eating well. And that could be why. Did they say what the cause of this was?
No, it just said that research surveyed that 13 patients who could have been diagnosed having scurvy and another 39 who tested positive for scurvy but did not have any documented symptoms. As per an ANI report, among those with scurvy, some were related to alcohol use disorder.
Would you send me that? I'm curious because I have some colleagues at McGill, and I'd like
I would.
to
And
know.
they said other, but the majority were related to other causes of malnutrition, such as persistent vomiting, purposeful dietary restrictions, mental illness, and social isolation.
That's what I was thinking, that it's malnutrition as well. Actually, the vitamin C in scurvy is one of the first double-blind clinical studies that was ever done. Did they talk about that? That's why Britons are often referred to as limeys.
No, I don't think they've
That usually
spoken
is in
about
the colorful introduction when they talk about when they do studies. It was first discovered that I think James Lind, L-I-N-D, I'm going into the gray matter here, noticed that these sailors, these British sailors, were coming back or dying at sea from these long voyages, and he hypothesized for whatever reason that it was a vitamin C deficiency, and so they sent some soldiers out with vinegar and water and some with limes and some with other food, and ultimately the bottom line is the ones that were getting the limes were not getting scurvy, and it couldn't be cooked or it couldn't be juice because heat denatures, or not like protein, but it breaks down vitamin C, right? Because it's, as a water soluble, there are vitamins that are sensitive to light, like riboflavin. That's why your milk, which is high in vitamin B2 or riboflavin, you have to store either in a dark container or in a closed refrigerator, preferably both, because it breaks down in the presence of light. Vitamin C, in addition to being water soluble, is also heat sensitive and can be broken down in the presence of heat. So that's why fresh citrus was what saved these soldiers, these sailors. So, okay, thank you. Okay, Megna.
Oh, Professor,
Oh, yes.
also, Sorry, I think Meghna just texted me saying that her laptop's not working. I think she's
Okay,
going to email you as well.
that's
She
fine.
said, could I just tell you before before the
Yeah,
call
I mean,
even?
I'd like to have her do it in class. I'll talk to her about it. That's fine. Things happen. All right, Kevin, what do you have for us?
Hi, so I was looking into that, like stuff about our class on like athletic performance and diets regarding each athletic performance. So we know from class that most athletes have to load up on carb for their performance because that's the first source we burn, especially for endurance activities. And so my roommate is a CrossFit athlete and he eats like a dinosaur. So I looked into like the type of diets for CrossFit and I found this article about it's called the Zone Diet, which is a diet that is built around like anti-inflammation. And so breaking it down, it's 1/3 of your plate should be protein, 2/3 carb, and percentage-wise, it's 40% carb, 30% protein, and 30% fat. And it seems like there isn't like a golden number for carb loading, because I found on this other article I was looking at, endurance athletes could load up to 70 to 75% of carb. And this, it makes me wonder, like, what is the, like, is there like a perfect number or like a area of number? Because 30% and like 40%, like 70% and 40% is really far apart.
I think in the fitness lecture there, Nancy Clark had some recommendations, like a certain number of 2 to 1. I forget what it was, but no, there's no magic number. I mean, the dietary recommendations recommend between 45 and 65% of your calories come from carbohydrates. The Zone Diet was really popular for a while. It was also known as the 40-30-30. I mean, I remember Legal Seafood having specific menus for people following the Zone Diet so you could get into the zone. No. A simple answer to your question. I'd say with staying within the dietary guidelines of 40, of 45 to 65.
I just find this really interesting because in class we kind of broke down between like aerobic and anaerobic exercises, but a lot of athletes are like multi-sport athletes or athletes or there are sports that contains both, like CrossFit contains both endurance and like high intensity training. Mm-hmm. So it's kind of hard to evaluate based on like fitness and diet.
Unfortunately, the athletes, like any other group of people or they're looking for the quick fix and whatever is popular and whoever is most popular and yells the loudest. You should see a registered dietitian for your particular sport, for your particular needs, and try not to obsess. Mm-hmm. How's that sound?
Sounds great.
Correct answer. Okay. Julia.
My current event talked about gluten sensitivity versus celiac disease and how people with gluten sensitivity have a very specific antibody profile that is very different from those who have celiac disease. So I know we had discussed in class the aspect of like, is gluten sensitivity a real thing, things like that. And a study through Columbia University found that antibodies produced by people with gluten sensitivity might lead to a better way to detect that condition and differentiate between celiac versus a sensitivity. And so recently, or until recently, doctors kind of dismissed complaints of people that said they were gluten sensitive because it was a very binary scale of one or the other. Right. But since they dismissed these complaints, they weren't taking into account the people who claim to be sensitive to foods containing gluten. But this study shows that people with non-celiac gluten sensitivity, like those with celiac, produce a high level of anti-gluten antibodies. But the two conditions differ in the type of antibodies produced. So that it's like same but different concept in a sense. But the team who was a part of the study analyzed blood samples from people with celiac disease and people who claimed to be gluten sensitive. And they found, and then they compared them also to people who consumed like an unrestricted like gluten containing diet. And basically the results had a lot to do with the B cells. And there was a lot of like intricate chemistry and biology that went behind it. But what they found was like gluten sensitivity is a real condition. And people, it's all about the antibodies versus celiac and gluten sensitivity.
Could you send me that article? Yeah, I'm sorting in my, opening up to this idea of non-celiac gluten sensitivity. What I'm now confused about is the issue of gluten intolerance as opposed to celiac disease. But that's another topic, and at least for me, it helped me change. But anyway, yeah, if you could send me that, I would appreciate it. Thank you, because that's the first I've heard of an objective measurement of the condition. You're saying it's a different antibody profile, and did it say anything about something called FODMAPs?
It did not, no.
Okay. Yeah, if you could send that to me, I'd appreciate it. Thank you.
Yeah, I mean, I'm familiar with the low FODMAP diet and like the gluten sensitivity and things like that. But this study was basically looking at like immune system reactions.
Right.
And they had again, similar mechanisms, but different antibodies. So I will send this to you.
Thank you. Yeah. Okay. Allie, what do you have?
Hi. So I was actually in the nail salon when I saw this woman come on the news, and she started talking about a guy who had just died from eating too much black licorice, and like the risks of black licorice, and eating 2 ounces of it every day is extremely harmful to you. So I decided to use that for my current event and kind of find out why she just said that, or why this guy actually died. So FDA experts say that black licorice contains the compound glycyrrhizin. I don't know if that's how you say it, which is the sweetening compound that's derived from the licorice root. And so glycyrrhizin can cause potassium levels in the body to fall. And when that happens, people experience abnormal heart rhythms, high blood pressure, edema or swelling, lethargy, and congestive heart failure. And so it's called licorice-induced hypertension. And this is when the glycyrrhetinic acid being the root cause of the problem. So through its effects on the body's cortisol metabolism, which is, it's like when the body starts retaining water and salt, and it lowers the potassium levels. So the enzyme in the body that acts as a gatekeeper with the cortisol on one side and the receptor on the other, not allowing the cortisol to get through because it's continuously inactivated. And licorice stops that inactivation and allows the cortisol to pass through. So this study that I found, they basically looked at people who had experienced problems or even death from like over licorice or more high, glycyrrhizin. And so they found that certain people or conditions were more sensitive to such a overdose, I guess. So old age, anorexia nervosa, and female sex, actually. And so they compiled all these related complications, and they put them into categories such as cardiovascular, neurological, electrolyte, and renal abnormalities, and allergic reactions to it. So overall, they found that it was the dose that makes the poison, essentially, but just kind of crazy that such a popular candy can cause such serious complications. Thought it was interesting.
About that. Well, and see, not all black licorice is black licorice. Some of it is just black colored licorice, but this is the real thing. Yeah. And I know it has
to be from like the root. A lot of it is just like a sweetener that uses like a flavoring, but if it's true black licorice, like from the root, then that's what it is. It's crazy.
Yeah, no, somebody was using black licorice on one of my baking shows, and I was like, oh my God, not too much. One of my baking shows, because they don't belong to anybody else. Yes, of course. Thank you. Okay, Katie.
So my current event was about if eating soy was healthy or unhealthy, which I always like soy milk, but I was told that soy is not good for you. So
okay, go ahead.
So I wanted to so I came across this article and I wanted to kind of learn more about it. And it said that there's a lot of positives to soy, and then the negatives to soy that people talk about. There's no scientific evidence that really supports any of the negative side effects. So
shocked.
That's basically my article. But the positives of soy, that it could improve, it could lower your blood pressure, blood sugar, cholesterol, may improve fertility, reduce symptoms of menopause, protect against certain cancers, like digestive cancers, prostate cancers, and endometrial cancer. But people think that soy causes cancer. So I thought that was interesting to see that it actually improves or helps you.
So where did you get this article?
I mean, I did this like 2 weeks ago, so I couldn't tell you off the top of my head.
I'm just saying all the magical things and the wonderful things they're saying about it makes me think that it's soy people that are putting it out. That's all. So it sounds like there's a bias towards eating soy, which is, you know, it's not going to do all those marvelous things to everybody all the time. And it may not do anything to anybody any of the time, but it's not going to hurt you.
Yeah.
Yeah. I know I'd have male students say, well, I don't eat soy because it's going to give me breasts.
Yeah, that's the other thing it said.
Yeah, sure. Not happening. Yeah, okay. All right, thank you. Okay, let's see, what did I want to, let me just share, see if I can find my screen again. All right, so for folks who had posted on the Padlet, Alejandra, your grandmother, whenever you got sick, gave you soda. Does it work? Well, what can you tell us about it? Did it work?
It was when I was,
Oops.
it was when I was little, that whenever I would get sick and I would want to like throw up, she would give me white soda, so like Sprite.
Uh-huh.
I don't think it worked. I don't know.
So I should, it's like an old wives' tale, but it for some people it does calm their stomach. Because I can't drink bubbles for whatever reason, it burns my tongue. When I was little, my mother used to give me Coke syrup instead of Coke. And did it work? I don't know, you know, but for some people it might settle their stomach. What you're doing is not eating and you're rehydrating. So it might be a combination of the two. And Annabelle, is it true you should detox regularly? Annabelle, you should never detox. And I just did a seminar for Harvard Pilgrim last week on this, but I had to cut out a bunch of slides, so I may just re-record my whole presentation for you folks, because that's something that we're going to cover the last week. But do you have any specific questions about detoxing?
No, simply like they always told me like in ballet and that you should like detox in order to like remove all the toxins from your body. And
right. And nobody ever says what the toxins are that are being removed. As long as your kidney and your liver are working, you're detoxing what your body needs to do. And Gabby, people say melatonin works. That's right. People say it works. There's a prior probability for it to work, but that's because the body makes melatonin. So I had a student telling me he was taking 10 times the dose. I was not happy about it. So I don't, you know, it doesn't work for everybody, just like medications don't work for everybody. But is there a specific diet I can follow or any supplements that are useful? No. I would be happy to talk to you sometime, though, because I am a student of cognitive behavioral therapy for insomnia, and I wish I would have done this decades ago. So if you have some sleep issues, I would be happy to talk to you about those, or at least give you some information for a guy named Martin Reed, who is the person that I worked with to help me with my sleep issues. What do you think about that, Gabby? Because I know sleep's
that would be good. Thank you.
Okay, so get in touch with me. We can meet and talk about it, okay?
Okay, thank you.
All right. And let's see. So now I think, oh no, I just wanted to say, so today at noon, I know I usually try to have office hours after class. I will be around till 12, but there's this seminar going on. It's online and it's free. I may have sent you something about it that I want to listen to at the Trottier Symposium at McGill Office for Science and Society. And so I'm going to be there today from 12 to 2. I'll be here, but I'll be there. But if you want to meet, and this is the only time you can get together, of course, I'll talk to you. In the meantime, I'm going to divide you into 5 groups and pick your question. It should be somewhere in the video, but yeah. Okay, group 1. What's your question and what's your answer? Hello. Annabelle? Who's your reporter?
So we divided the work. So I answered the first question. So what's the difference between absorption and storage of fat-soluble vitamins and water-soluble vitamins? So I said the water-soluble are absorbed in the portal blood and are excreted in urine, and that fat-soluble are absorbed in the lymphatic system and stored in the liver or the skeletal muscles, and they can be stored in the body for a longer period of time than the water-soluble.
So you're saying the fat-soluble vitamins can be stored in the skeletal muscle? No, the reason why I'm saying that is because, we have fat cells all over the body. So it's not, we don't just have one area where fat is. So that what happens, for example, one of the questions about in fitness, do you lose muscle? Once you stop exercising? No, you don't lose muscle. It loses tone and fat cells infiltrate into the muscle. So you can have fat cells in the muscle. So that's all. All right. How about rickets? Who've got rickets?
So I can talk a little bit about that. I talked more about why you should take vitamin D, but we noticed that vitamin D helps your body absorb calcium and phosphorus from food, and not enough vitamin D makes it difficult to maintain proper calcium and phosphorus levels in your bones, and that is what causes rickets.
Mm-hmm. And one of the reasons the pictures you see of small children that have rickets is they tend to, their legs kind of bow out at the knee, because what's happening is because their bones aren't strong, because in the absence of adequate vitamin D, the calcium doesn't get deposited, the weight of their body pushes down on their knees. The legs don't have the strength to hold the body up, so the knees start to bow out, have that, and that's sort of a characteristic symptom or presentation of rickets. Okay. Is anybody taking vitamin D supplements? Do any of you take vitamin D? Justin, and you take it because, if I can ask?
Okay, so I feel like I'm gonna regret saying this, but because I never go in the sun ever, so I never get any vitamin D. I feel like from the sun, so I supplement it. But I'm not sure if that's really effective.
I don't know either. I was on a placebo for 5 years, and my vitamin D levels were not high, but I don't recall any of my blood work looking insufficient. And I avoid the sun because many years ago I had a basal cell on my face. So it's and my goal when is to come back, dark when I'm on vacation. Sun is not one of my goals to be in. So again, just an N of 1, but it's being attributed lots of magical powers. I don't know, unless you have a vitamin D deficiency, whether or not you need it. Unless, like with bone. Okay, group 2. How about the transport and, I have transport and export? I didn't mean export, I meant excretion, but.
Yeah, I can talk about that. So water-soluble vitamins are absorbed directly into the bloodstream, so they're hydrophilic, meaning they circulate, travel, and are stored in water compartments and then excreted in the urine. And then when it comes to fat-soluble compounds, they're hydrophobic, so they're transported into the chylomicron along with fat and absorbed into the lymphatic system. So they're not readily excreted, but they are dissolved into fats.
And hypothetically, that's why you're at an increased risk for toxicity from fat-soluble than water-soluble, because you store them. The only cases of toxicities that I've read about are vitamin A, the animal form. And I think we're starting to see issues with vitamin D toxicity because everybody thinks it's the answer to everything. And those have to do, believe it or not, with fractures. There are some concerns with vitamin B6, which is a water-soluble vitamin. When people take mega doses of that, it can cause peripheral neuropathy issues, but they get reversed once you stop taking it because you tend to excrete what your body doesn't use. And Americans are said to have the most expensive urine in the world because of all the supplements we take. All right, how about the other questions? Oh, yeah.
So why does vitamin C deficiency cause scurvy? And this is because vitamin C is needed for making collagen, an important component in connective tissue.
Right. Does vitamin C prevent colds? Despite
So we
what-
said no, it can reduce the severity and the duration of it, but it doesn't. But it does not prevent colds.
Right. So did I have in my notes or my information if you take something for a cold, it'll go away in 7 to 10 days. If you don't take anything, it'll go away in a week to 10 days. That's our joke. Nobody gets it. Okay, I'm done. All right, group 3.
So our question is about the relationship between stomach acid and vitamin B12 and why someone on an acid might be at risk of a deficiency. So vitamin B12 needs a protein called the intrinsic factor produced in the stomach in order to be absorbed by the body. So if someone's on a long-term antacid treatment for GERD, the pH of their stomach may be too high and therefore unable to absorb B12.
Okay, right. So whoever has B12 for your nutrient sales pitch, that might be a fun haha fact or not. Okay, group 4.
So we said that oxidative stress was a condition where the production of free radicals exceeds the body's ability to defend itself. So the free radicals are the unstable oxygen molecules that can be formed from sunlight, smoking, or pollution. And then in terms of the related development to chronic illness, we said that long-term imbalances can lead to the development of chronic illness, and also that oxidative stress can damage lipids, proteins, and DNA cells and tissues. So this can lead to chronic diseases such as cancer, diabetes, arthritis, cardiovascular diseases. And then the last part we found was that it can cause chronic inflammation, which also can lead to more the development of more diseases.
And just remember, whenever you hear the word may or can, also think may not or cannot, that there's no one factor that's going to lead to chronic illness. Oxidative stress might, lifestyle might, diet might, genetics might. So there's a lot of factors that are involved in the development of chronic illness. Group 5.
We said that waterless cooking is the best way to preserve nutrients when you're cooking vegetables. So you can do like steaming, stir frying, or like microwaving. And frozen vegetables can also be steamed, so that's always good. And then a very low-fat diet. So like vitamin travels through the body through fat. So certain vitamins such as like A, D, E, and K. So if you have like a low-fat diet, that you can miss out on like those important fat-soluble vitamins.
Okay, very good. All right. Yeah, I would see folks, depending on how they're trying to lose weight, if they're trying to lose weight, that people would eat these bags of carrots because they contain beta carotene, and beta carotene's an antioxidant, so I must eat it. But they wouldn't have, they would have fat-free cheese, they'd have diet soda, and there's no fat in the meal. So yes, they're getting beta carotene, but you need the fat to incorporate the beta carotene into the chylomicron. So you can get that beta carotene into the body where it can be used. So you need fat, you need protein, you need carbohydrate. Any question about our discussion questions? All right, then I have, let me share. Let's see. Come on. So there's a lot of information in vitamins and minerals, and this is, I'm going to post as a study guide. Let's see if it's working, but I want to do it with you folks right now. So I need somebody, this is my vitamin Jeopardy game. I need somebody to start. And then when we're done playing Jeopardy, we're done. So who wants to go first and get us started? Justin, pick one.
Did you pick me because I look like scared of it?
Well, I picked you because you're for some reason you're at the top of my screen. Sorry.
Can I do food sources for 3 points?
By the way, the points have nothing to do with how hard the question are. It has to do with my ability to play with this Jeopardy.
Okay.
Whatever. So there's no relationship. And actually, there's a gremlin that lives inside all of my Jeopardy games that tends to hiccup and make things go wrong. So that's my excuse, and I'm sticking with it.
I'm glad I didn't pick 1 point. Wait,
All
so
right.
what do we...
Well, Jeopardy is a game where you get the answer and you have to, what's the question? So the answer is pork. So what's the question?
We guess the question?
You're supposed to ask the question. This is not supposed to be stressful. If you want to, Pepe has an answer if you would like her to.
Pepe, can you help me with this? Are we supposed to talk about like the vitamins in pork?
No, you're not. It's a game. We're playing a game now. This is fun. We're having fun now.
Okay.
Okay, so Pepe.
I'm gonna phone Pepe.
So you can get thiamine, like vitamin B1, from consumption of pork.
Right. So what you're supposed to ask is, whoops. So if, I guess, I'm so old. Jeopardy is where you get the answer and you ask the question. So the answer is pork. So the question is, what is an excellent source of thiamine? You're supposed to respond in the form of a question. I'm Alex Trebek doing a horrible job. All right.
Oh.
Yeah, well, I knew what I was talking about. That's unfortunate for you. Okay, so Pepe, you want to pick another one?
Sure. Comparison of water-soluble vitamins and fat-soluble vitamins. 1 point.
1 point. Excesses of these are excreted in the urine. What's the question?
Am I supposed to answer
Sure.
that?
Anybody. I'm dying here. Somebody, please.
Maybe like which type of vitamin excretes excess in the urine?
Yeah. What's the question? What are water-soluble vitamins? Yeah. Okay. Scarlett.
I'll do food sources for 2 points.
Milk, cheese, and the sun. What's the question, if this is the answer?
What is vitamin D?
Okay, let's see. That's correct. All right, you get to ask a question. And you get to pick one.
Let's do potpourri for 2 points.
Okay. Will not treat night blindness unless it is caused by a deficiency of this vitamin. What's the question?
What is vitamin A?
That's correct. So are parents still telling kids that they're supposed to eat carrots in order to prevent night blindness? Or is that old? Because it's a lie, but you should still eat carrots. Okay. Okay. Now you can, somebody else? Or you want to pick another one?
I'll do water-soluble vitamins for 4 points.
Decreased risk of toxicity when consumed in excess for a long period of time. Remember, the topic is water-soluble or fat-soluble. So what's the question? Which one has a decreased risk of toxicity when consumed for a long period of time?
What is fat soluble? Or what is water soluble?
Water soluble. Why isn't it fat soluble?
Oh, because fat soluble is longer lived, right? Even when it's a normal intake.
That's right. We store fat soluble vitamins in our fat tissue. So until it's all broken, so we can store it for longer than water soluble vitamins. Yeah. Okay. Alejandra. Anyone. There's no relationship between point value and how hard it is.
Can I do food sources 5 points?
The law requires these to be added back into processed grains. You can phone a friend. Let's mix all our games up.
Vitamin B?
How quickly they forget.
Is vitamin B needed to add it back? I don't know.
Vicky.
Which law does which vitamin does the law require to add back? I don't know. I know it's one. I don't know how to formulate the question.
Okay. Georgia.
The Enrichment Act.
What's what? Oh, that was the, oh, okay. See, there you go. Well, my question, but you're right. Sorry, bad question. That's why it's a game and not an exam. What are thiamine, niacin, riboflavin, iron, and folic acid? The law required these be added back. So I apologize. Go ahead. Pick another one, Alejandra. Oops. Pick another one, Alejandra.
Okay. Comparison for 4 points.
Oops, sorry, I picked the wrong one. This one. I'm sorry, are you folks in the room with me or am I ignoring you completely?
Okay.
I will say it's sort of similar to the previous question that we didn't get right. These vitamins. All right, I'm going to give you a break now. I've been hard on you. Victoria, why don't you pick a question or an answer?
Food sources, 1 point.
Cooked carrots provide a lot of this. What's the question?
What are vitamin C? I can't remember.
Anybody else want to try this one?
Wait. I'm trying to formulate it in a question.
Okay, well then just give me an answer.
What are vitamin A?
Like beta carotene.
Right. What is beta carotene, which is the vegetable form of vitamin A? This is a real success here. Allie, do you want to try another one?
Yeah, sure. Maybe comparison of water soluble, fat soluble for 2.
Hydrophobic.
What is fat soluble?
Yes. Okay. Kat.
I'll do food sources for 4 points.
Food sources for 4. Leafy greens or foliage. That's the hint, foliage. Which B vitamin? Yes, Vicky.
B12.
No.
What is vitamin? Oh.
What is folic acid or folate? Foliage, F-O-L. I tell people, remember, foliage is B. Or it's actually, no, I don't know if this one's B9. I didn't get the memo. Let's see. Kat. Oh, no, I just asked Kat. That's okay. Katie. Oops, let me. Oh, dear.
Can I do FSV for 3 points?
Fat soluble vitamins for 3.
Oh, God.
Well, now we have 4 fat soluble vitamins. So you have a 1 out of 4 chance of getting it right.
I'm not sure.
Anybody?
Friend.
Uh-oh. You don't seem to have any friends today. It's vitamin E deficiency, hemolytic anemia, particularly in the newborn. It is a concern that a vitamin E deficiency can cause bleeding because it's involved with red blood cells. So that can be. Okay. Gabby.
Fat soluble vitamins for 1 point. Is it vitamin A?
Yes. What form of vitamin A?
That I'm not sure about.
Well, we have the animal and the vegetable form. So what
Oh,
do you,
the vegetable.
right. So that would be beta carotene. Okay. Christy, are you still with us? I don't see you on my screen.
Her computer crashed. She just.
Oh. All right, Sasha, then you can go. Then you go. Pick one.
Potpourri for 3 points.
Potpourri. At least that's how I pronounce it.
Yeah, I don't know.
Oh, here we go. We have several names for the animal form of vitamin A.
What is retinol?
There you go. Very good. What are the retinoids? Retinol, retinal, retinaldehyde. I'm just going to go through these because I feel like I'm pulling teeth. But I will call on you for answers. So let's see. Kevin, are you still with us? Oh, you're at the bottom of my screen here. All right, Kevin. What circulates, travels, and is stored in the watery compartments of the cell? It's water soluble or fat soluble. So you have a 50-50 shot.
Water soluble.
There you go. What are the water soluble vitamins? Because the fat soluble vitamins are incorporated into the chylomicron, transported in the lymph. They're processed like fat. Okay. Julia, what do you have? What do you want?
I'll do water soluble vitamins for 1 point.
Gertie.
What is a vitamin C deficiency?
There you go. Very good. Okay. Annabelle.
I'll do water solubles 3 points.
May take up to 7 years to develop pernicious anemia. What water soluble vitamin? The answer is B12. Even though it's water soluble, we have a storage of it in the liver. And that's why it can take a long time to develop B12. With vegans, it is a concern that they may develop B12 deficiency because the best sources, if you will, the most bioavailable sources of B12 are in animal products. Not that you can't get them in non-animal products, but they are found most of the time, the most bioavailable in animal products, but it can take a long time to develop if they were eating meat before they became vegan, before they just started that lifestyle. Pepe.
Fat soluble vitamins 2.
Increases intestinal absorption of calcium.
What does vitamin D do? What is vitamin D?
Yeah, very good. Okay. Kyle.
Let's do water soluble vitamins for 2.
I'll give you. What happens when you take too much of B3? It's called a niacin flush. Vitamin B3, it's also given as one of the treatments for high cholesterol, but you need to be under medical supervision because the form of vitamin B3 is a megadose. It's a pharmacologic dose. And it's a vasodilator in some instances, and it can cause flush. So I had a professor in graduate school who experimented with this and ran up and down the hall when he was experiencing the flush. Never left my mind. Sarah.
Water soluble vitamins
for
5 points.
Works with vitamin B12 every time a cell divides. Which B vitamin does this?
Can I phone a friend?
Absolutely. Any friends?
Folic.
Okay.
What is folic acid?
Folic acid or folacin or folate. Every time a cell divides, it involves B12 and folic acid. These are involved with DNA and RNA every time a cell divides. And that's why it's important if someone is being tested for a deficiency that they look at both B12 and folic acid. Because if you have a folic acid deficiency, but you're treating it with B12, you're not going to cure the folic acid deficiency. Okay. Tyra.
I will pick water-soluble vitamins for 4 months.
You should store this in opaque containers or dark containers to prevent the ultraviolet destruction of this vitamin. Milk is stored in, I'll give you a hint, it's milk that gets stored in opaque containers.
Is it vitamin D?
It's riboflavin. That's why milk is, you refrigerate milk, that's why it's stored in opaque containers so that light can't get through it. People that have their milk delivered in glass containers usually have a milk box that it can be placed in order to prevent the destruction, or one of the reasons of of vitamin B12. Mylin. Oops, let me get back.
Okay, can we do potpourri for 3 points?
An antioxidant fat-soluble vitamin. Yeah, 1 out of 4. Well, 2 out of 4.
Vitamin E? Yay, okay.
Vitamin E or beta carotene. I'll do these, okay. And the edible form of vitamin A, we had this one. What are the retinoids? Retinol, retinaldehyde. Infants are given a shot of this at birth because their digestive tracts are sterile. This is vitamin K, all right? Infants are born with a sterile, this is important, sorry. Infants are born with a sterile GI tract, gastrointestinal tract. They haven't made, they don't, and one of the functions of the bacteria in our gut is to synthesize vitamin K, and vitamin K is involved in coagulation of blood. Once an infant starts nursing or getting formula, then they get the bacteria introduced to their GI tract and they can start producing vitamin K. There are people who don't believe in the science of vitamin K being given at birth. They refuse to let their infants have these shots, and there have been documented cases of brain bleeds and hemolysis because the blood can't clot. So vitamin K. Oops, keep doing that, Leanne. The liver and kidney are involved in converting this to its active form. This is vitamin D. Oops, I just keep wanting to do that. And last but not least, incorporated into the chylomicron and transported in the lymph. What are fat-soluble vitamins? All right, thank you. So Wednesday, we have the